The hospital is seeking some $30.5 million in general and special fund money to help cover fiscal year 2023 operations. That's just to augment a projected $175 million in income from revenue and grants. GMH CFO Yuka Hechinova says it's mostly to cover increased personnel costs.
Primarily for the increases, the pay raises for the nurses, and we have differential pays for the nurses and other clinical staff as a recruitment and retention strategy.
CEO and Administrator Lillian Posada says as the pandemic eases, GMH is also looking to scale back on the use of expensive travel nurses. In fact, they're currently in discussions with the Sharp Rosemont Hospital in San Diego, which has a local connection.
A lot of the nurses in that hospital in San Diego are from Guam. And so the person that we spoke to the other day is also from Guam and is just reaching out to us, GMH, to see if they can give us some resources with regards to not just staff nurses, but also those clinical nurse specialists who are experts in their area of practice to help us and to augment our services at GMH.
Officials say they also plan to bring online in August a brand new electronic health record system, a critical operational asset that's been long awaited. And just this month, GMH took one of the first steps in regaining accreditation. Posada says they just received the results of a mock survey that was conducted earlier this month and are reviewing corrective actions they need to work on.
The next mock survey is scheduled for the end of this year, sometime between October or up to December 2nd. We haven't yet received a confirmation date, and it will be a survey on the clinical side of the operations. Once they complete that mock survey, the end of December, we have 6 months to apply for the actual survey. And when they do receive our application for the actual survey, they will come unannounced.
The hospital is seeking accreditation from a different group than in past years. The Center for Improvement in Healthcare Quality, or CIHQ, is the nation's newest accreditation provider. It's approved by CMS, the Centers for Medicaid Services, for acute care hospitals seeking Medicare participation. For KOAM News, I'm Nestor Lecanto.